In grad school, many therapists are taught to stay away from self-disclosure. However, many find out in practice that's not so easy, and that self-disclosure can actually be very therapeutic at times. From what I see in debates online, there's definitely a group of therapists that feel as though no self-disclosure or very minimal self-disclosure is best. And there's another group that are much more free and comfortable with their self-disclosure. But it's hard to know what the best answer is when it comes to self-disclosure and how to use it. I recently came across an article though that answers these questions and provides a framework to help guide self-disclosure in session. So let's take a look at therapist self-disclosure, the risks and benefits of it, and that framework that can help guide it. We'll begin here by defining what therapist self-disclosure is. But first, my name is Keegan. I have a master's degree in counseling and I'm a licensed professional clinical counselor. I make videos like this to help you better understand various concepts in the world of psychology, counseling, and mental health. Keep in mind that engaging with this channel does not constitute a therapist-client relationship. This content is for educational and entertainment purposes. This does not substitute or replace professional mental health care. It's important to define what therapist self-disclosure is. Broadly, this is when the therapist discloses information about themselves or their life experiences to a client. There are, of course, various levels of self-disclosure that a therapist may engage in. It's important to recognize, though, that a therapist disclosing nothing is basically impossible. This is because what a therapist is wearing, what their office looks like, and many other forms of self-expression that we can't help doing to some level, even in a professional setting, are all forms of self-disclosure to some extent. And I don't think that we can avoid these or work around these entirely. That said, I think that for the most part, when we talk about therapist self-disclosure, we're often going to be talking about this more in terms of what the therapist is sharing about their life and their experiences throughout life with a client. This might include things like if they have children, if they recently experienced a death in the family, different positive experiences that they've had, or if there's something that they have in common with the client. There can also be very subtle forms of self-disclosure that therapists do in typical interactions with a client. For example, most clients at some point will reference different shows, books, or movies that they're watching based on how the therapist interacts with the client while they're discussing these things, such as how they're responding, if they seem to know more about that show, movie, or book, or what questions they're asking. These can all be very subtle forms of self-disclosure by the therapist, even if they're trying to avoid fully self-disclosing. Something that complicates matters here for our discussion, though, is that therapist self-disclosure is not well defined. In Skills in Person-Centered Counseling and Psychotherapy, they state that they use self-disclosure to refer to communications which are not related to the here and now therapeutic relationship. I take this to mean that a therapist commenting on what's happening in the room in the moment would not fall into their definition of self-disclosure. However, others would say that the here and now comments by a therapist are a form of self-disclosure. For example, if a therapist says something like, "I noticed myself feeling sad as you share that. What's it like for you to discuss this?" While some would identify that as a form of self-disclosure by the therapist, that can be a very powerful and therapeutic approach for some clients. Looking at the recent article from Danielle Jeffery, she defines therapist self-disclosure as the therapist's intentional sharing of personal information, experiences, or reactions with the client. Given that her article is what inspired this video, we're going to stick with her definition as we go through the video. In her article, she highlights how therapist self-disclosure can be helpful at times, but how it can also be harmful at others. So let's talk more about that. In her article, Jeffery explains how appropriate self-disclosure by the therapist can have multiple positive effects. This includes strengthening the therapeutic relationship, further engaging the client, and providing experiences that are emotionally corrective. She also highlights, though, how this self-disclosure can be harmful to clients. She explains that when done inappropriately, self-disclosure may violate boundaries in the therapeutic relationship, cause the client to feel uncomfortable, put focus on the therapist instead of the client, or make the client feel that they must care for the therapist. So what self-disclosure is appropriate and what is inappropriate? Well, that's part of the problem. What's considered appropriate and helpful in one situation can be seen as inappropriate and harmful in another. In her article, she highlights how there's a lack of training and research to help therapists determine what self-disclosure is going to be more helpful and what might be more harmful. There's another aspect of this, though, that complicates things further. Seeing that there's a lack of guidance on how to disclose and a risk of harm for clients when the therapist does self-disclose, many may opt to be reserved and share little to nothing about themselves. However, this doesn't seem to be the right answer either. On this, Jeffery says, non-disclosure, particularly in cross-cultural contexts, may also contribute to harm, including client mistrust, relational disconnection, and the reinforcement of systemic inequalities. Thus, therapists are not choosing between disclosure and neutrality, but rather navigating a complex relational process in which both disclosure and non-disclosure carry potential risks and benefits. In other words, to disclose nothing about ourselves can carry risks and potentially be harmful to clients and the therapeutic relationship. We'll talk more about her guidelines for self-disclosure shortly. But first, I want to share some of her key points related to therapist self-disclosure, how they can impact the therapeutic relationship and be helpful to clients. For one, therapist self-disclosure can help deepen the therapeutic relationship and demonstrate compassion for the client. It can also help the client to recognize a shared humanity between them and the therapist. Second, the therapist disclosing what they see happening in the moment can have multiple positive effects. It can help the client feel a deeper connection, encourage the client to open up more, and help them engage further in the therapeutic process. Third, disclosure by the therapist can help the client recognize and see the therapist as a real person. This has been found to help the client trust the therapist more, help them see the therapist as more genuine, and generally helps to strengthen the therapeutic relationship. Fourth, clients share a lot in therapy, and it can be an extremely vulnerable process. Therapist self-disclosure, when used correctly, can help reduce the shame that clients might feel about their situation, and can also help clients feel less alone and isolated. Danielle Jeffery also discussed the importance of therapist self-disclosure related to multicultural contexts. In these situations, she says that self-disclosure was identified as a mechanism for cultural broaching, enabling therapists to acknowledge and engage differences and similarities in identity, power, and lived experience. She goes on to say that therapist self-disclosure related to cultural broaching has multiple positive effects. This includes reducing any perceived cultural imbalances, increasing a client's feelings of safety with the therapist, creating space to discuss differences in identity, and increasing authentic engagement in therapy. Let's now move on to discuss some of the important aspects of therapist self-disclosure as well as Jeffrey's framework for this. But first, if you're enjoying this video and finding it helpful, please help me out by giving it a like and subscribing. When it comes to best determining if it's appropriate to share something with a client, Jeffrey found that Carl Rogers' core conditions provided some level of guidance on this. Rogers' conditions are also called the Therapeutic Triad. This involves accurate empathetic understanding, or accurate empathy, congruence, and unconditional positive regard. For accurate empathetic understanding, this refers to a therapist's ability to anticipate and respond to what a client is experiencing. Congruence refers to the therapist's ability to be authentic and genuine with a client. And unconditional positive regard is when a therapist works to be non-judgmental in how they're approaching and interacting with a client. Jeffrey explains that this therapeutic triad alone may provide a level of guidance to therapists in helping them determine how and when to self-disclose. However, she used these to create a framework that therapists can use in the moment to help them decide what to share and how to share it, or if they should shy away from the self-disclosure and use a different approach instead. The first part of her framework pulls from the concept of congruence and encourages the therapist to ask themselves, where is this disclosure coming from? This requires the therapist to reflect on the urge or the feeling that they have to self-disclose to the client. If the therapist is being driven by an urge to tell the client something to help relieve their own anxiety or help the therapist feel better, this may be an indicator for the therapist that this may not be the most appropriate time to self-disclose. But if the therapist is feeling driven to self-disclose because they feel that this could be helpful for the client in some way, and they can identify ways that it may help the client, this may be a time where that self-disclosure is more appropriate. The second part of the framework asks, how might this disclosure be experienced? And pulls from the concept of unconditional positive regard. This step encourages the therapist to reflect on how the client might feel when they hear this disclosure. If the client is likely to feel understood, accepted, or cared for, this might be a sign that it's a more appropriate self-disclosure. But if the client might feel more shame, pressure, or judgment, this is likely an indicator that the disclosure should be avoided. Lastly, the final step in the framework comes from the concept of accurate empathy and encourages the therapist to reflect on the question, is this responsive to this client in this moment? Reflecting on this question, the therapist should not only consider the client in that very moment, but should also consider the client's history that's gotten them to this point. For some clients, it can be overwhelming to hear a struggle or a situation that the therapist has experienced. But for other clients, this is something that can be validating and help them feel less ashamed or alone. Putting all of this together, hopefully you now have more to consider as you're determining if you should disclose or not to a client. As we discussed, self-disclosure is something that many are taught not to do. However, we see that in practice, this is an approach that can be very helpful. Not only that, but to not self-disclose can actually be harmful at times. Using Jeffery's framework, this may help guide you and help you make a more informed decision about whether to self-disclose or not. But now I'm curious, what are your thoughts on therapist self-disclosure? Let me know in the comments. That brings us to the end of this video. I hope that you found it helpful. While you're here, make sure that you check out some of the other videos on my channel. Thank you so much for watching.